Fort Worth, Texas.
Yeah. Am I in frame? Well, thank you all very much for your time this evening. I really appreciate it. My name is Dr. Shane Reeder, and I want to start with a thought experiment. So transport yourself back to your preferred regional grocery store. I'm going to grab something off the shelf, maybe some buttery flour tortillas. And what makes this a thought experiment and not just nostalgia is that I have in my pocket a little plastic card called a most favored customer card. And what this does is guarantee that I, as a customer, am going to get the best possible price on buttery flour tortillas. So I walk up to the cash register and I swipe that card and I see my total increments down a few cents. I just got the best deal on this item. But right behind me is somebody else who had a 2-for-1 coupon for buttery flour tortillas that poof, disappears. They cannot get a better deal than I do. So while I save just a few cents, what I've also done is increased the price that they're going to pay, again, for buttery flour tortillas. So this is actually happening all across the healthcare sector in private employer-sponsored health insurance today. I want to talk a little bit about how we are experiencing this as patients and customers, and then I want to talk about some potential solutions. So in a competitive health insurance market, your doctor, the primary seller of healthcare, should be able to negotiate individually with each insurer, the primary purchasers of healthcare. So insurer A is, for instance, a large, highly consolidated network. Your doctor should charge them perhaps higher prices. But insurer B is a local HMO. It's a smaller patient pool. Perhaps they'll charge them lower healthcare prices. That is until insurer A introduces a most favored nation clause into their network contract. This is a contracting clause which says nobody else will be charged less for each healthcare service than insurer A. Now, instead of lowering rates across the board, bringing insurer A's prices down to insurer B, what your doctor has to do in order to stay in business is increase the prices that everybody pays up to insurer A's level. So this creates an artificial price floor under which healthcare costs may not sink. And now, we certainly experience that as consumers, not only in our cost-sharing agreements such as coinsurance and copays, but also in our monthly premium. Insurers do this even though they might be paying more in healthcare costs because they can just take those increases and package them and give them back to us as our monthly premiums. So we're paying for this even when we're not directly using healthcare. Additionally, this is a major barrier to competition and innovation in the health insurance market. So insurers are no longer competing to get good prices for healthcare. They're all comfortable at this high cost floor. That also increases the amount of capital that new insurers need to come into a different market, and it keeps doctors from being able to contract with potential innovative insurance products, novel ways of structuring payments, because that can eat into their bottom line with unrelated insurers. And it forces these providers to share competitive information. They have to share how much they've negotiated on with other insurers for different healthcare services. That's information they should be able to keep close to the vest because that's information that is leveraged against them in negotiations. So these are a lot of really entrenched issues, and the question is, what can we do about it? Well, as the laboratories of democracies, states have come up with a very effective solution, and that is just to say no. Just to prohibit the use of most favored nation clauses in health insurance network contracts within their borders. And you'll notice these states are geographically diverse and they're also politically diverse. This is not a highly partisan issue. What's really amazing is that when these states adopt these prohibitions, 2 years later, they actually see reductions in standardized hospital admission costs in highly consolidated metropolitan areas within those states. Highly consolidated metropolitan areas include, for instance, my hometown of Houston and us right here in DC right now. A 2.8% decrease in standardized hospital admission costs compared to states which did not adopt this solution. What we need to do is extend these savings to us here, to my hometown of Houston, right? Bring this to us here in DC. We need to take this innovation federally. And what's really awesome is that there actually is already legislation that exists to do that. It's called the Healthy Competition for Better Care Act, and it was originally introduced in 2021 in the 117th Congress. And it was, in fact, co-sponsored by both Senator Mike Braun from Indiana and Senator Tammy Baldwin from Wisconsin. So this is bipartisan. This is common sense, bipartisan, pro-competitive reform to relieve financial burdens on American patients and consumers right now. We need to reintroduce this bill, and we need to get it to the president. And if we do, what we're going to do is re-enfranchise doctors to negotiate prices. I think that small business owners should be able to set their own costs. And once we do that, we're going to break this cost floor so that we can get more competition into the market, and that's going to reduce the cost that we pay, and that's going to keep our premium costs from accelerating as rapidly. I can't promise you that premiums will objectively go down. I can say the evidence suggests that premiums will not rise as quickly as we otherwise would anticipate. And then we're going to open up the market to innovation. And here's the part where we don't even know what these potential innovations are because they've been held back by this dense network of anti-competitive practices, novel ways of paying for care, novel schemes for cost sharing, all these potential innovations that have not been able to come to the forefront because doctors cannot risk signing on and compromising their bottom line elsewhere. That is, again, why we need to reintroduce and pass the Healthy Competition for Better Care Act. Thank you. I have time for questions.